Hello everybody and welcome back to my channel. Thank you for tuning in to yet another video. Before we get into it though, I want to thank you all. Thank you for joining our little family. It's growing. I always say this, but it is growing. It is growing. We're getting bigger and bigger and bigger. So thank you so much for all the new subscribers. Today's video is going to be about clinical documentation. I was looking on YouTube and there's like not that many videos about clinical documentation. Now, a lot of like American videos about like charting and stuff like that. But I don't know. I just feel like it's a topic that really needs a lot of attention because we always forget that clinical documentation is a really important thing. Why? Because it's actually a legal document. That's why you're supposed to have a signature. So like I'm gonna like highlight the main things that you need if you're ever like stuck, if you are a first year student nurse, second year, third year, even fourth year, or even just starting off as a nurse and you're kind of like stuck on how you're gonna document. Listen, I've been there. So when I'm doing these videos, it's because I know it's gonna help somebody. That's my aim for this channel. Like, I just want to help one or two people, or even more. Like, the more the better. But I just want to, because like there's nothing worse than like knowing you have to do something and you don't know how, and you're like going like, how am I ever going to learn how to do this? Like, is somebody gonna sit me down and like show me? Like, so this is why like I think nursing documentation or charting like is something that is so important, but I don't feel like we get that much education in college or university about it. So that's why I kind of felt prompted to do this video. So let's get into it. The first most important thing that I always say when I'm giving presentations about clinical documentation is that it's a legal document, as I've mentioned, and it needs to be in appropriate chronological order. Whether you're doing paper-based documentation or electronic health records, you need to make sure that it is chronological. So if you've looked after a patient the whole day, you can't have like a small little snippet that you've written at like 7 o'clock in the evening because like you're running out of time of what you've done. I'm sorry, but you can't. It's not gonna stand to you if there ever, God forbid, something happens and they have to like, and then your documentation is pulled up. That's not gonna stand to you, and it's not gonna show very much professionalism. In clinical documentation, you want to make sure that it's chronological and that it shows the care that you've provided. So like in the morning, once you've done your vitals, your ADLs, you want to document that. Whatever's happened in the morning, document it as soon as you can. Document what you've done for all your patients in the morning. Mid-afternoon, something happens to go for a procedure, or they complain of pain and you give them something and it's not effective, and then you give them something else and then it becomes effective. The pain is like, what, 2 out of 10 now. Document that. Document when you're documenting it, it needs to be so morning, afternoon, evening, like as it's happening. Trust me, it's gonna save you a lot of time. So chronological order, you want to put the date and the time at each entry. If it's electronic health records, it's going to do that anyways, but if it's paper based, you want to put the time and the date. When it comes to the content of what you're writing, so I've just mentioned like pain relief and then the pain is better. It's really important that you show the effectiveness of what your care did. So like John complained of right leg pain. He scored 8 out of 10. Paracetamol given with very poor effect. Ibuprofen PRN charted. Pain now 3 out of 10 and effective. Yeah, that's what you want. Not John complained of pain. paracetamol and ibuprofen given. That's it. And then your like initials. I see initials a lot. It shouldn't be initials. It's a signature. You need a signature. It's a legal document. If you can like remember that it's a legal document, it's going to actually like help you and prompt you to make sure you take your time in what you're writing. And then on goes the next topic, the third topic. You need to make sure that your nursing documentation is unambiguous. What does that mean? Sometimes you write something and you're trying to read it and you're not really, you yourself don't understand what you wrote. So if you are doing this in nursing documentation, it's like really unclear, even to yourself, what's happening. It's gonna be unclear to somebody else. So it needs to be clear, so unambiguous. Like, not that it's like, you need to be able to read it and understand what's happening. Have a clear picture of the care that you've provided, and it's the care that you have provided. And it's really important that we stress on the fact that it needs to demonstrate that you really care for this patient, and the decision-making aspect of it as well. What happened? Now, if the notes say general temperature of 38.1, paracetamol given, and that's it. And then there's like a small note at the end and it goes nursed as planned, as per care plan. That's not the best way to get it. So you want to say something like, John had a temperature of 38.1. EWS score was 5. Medical doctor contacted as suspected sepsis. Blood cultures taken. Prophylactic antibiotics commenced. Vital signs to be taken every 3 hours. Paracetamol last given at 2 p.m. That's better, because that's like, it makes sense. It's not confusing. You're not left going, okay, so then what happened then? Oh, another thing you want to say, okay, when you're finishing off your notes, you want to say vitals rechecked again, temperature improving now, temperature 36.5. You need that. Sometimes people would just like write that line and it's so confusing, because whenever something serious happens, there's something called an AAR, after action review, that happens. And this process is quite lengthy and you go through like the nitty gritties of everything. And it's those really good documentations that really help us get to the bottom of what happened. It's not a blame game, but it's just trying to see how can we prevent a problem happening in future. Another thing about documentation is, if you make an error, especially paper-based, please don't like scribble over it. Have some of us done it before? Yes. Don't scribble over it. Just put a line, brackets around it, and just put error and your initials. That's it. And like, it's fine. Like, you might forget, you might mix up something, and like, you know, these things happen, but you don't want to have too many errors as well in your clinical documentation. It just, you know, it looks a little bit messy, but if that happens, that's the way to do it. Another thing is, I've mentioned that you need to write things in a chronological order. If you, for example, if you forget in the morning, you emptied John's catheter and it was 400 mils, and it was quite cloudy, and you took a urinalysis and it was positive. You didn't get a chance to write it in the morning. You forgot for some reason. You forgot to put that piece of information in. And the only time you've remembered it is in the evening around 7 o'clock. You can write 7 o'clock, whatever date it is, and then go retrospective note, and then put it in there. But in that retrospective note, you want to say, retrospective note, empty John's catheter at this time. Make sure you put the time that you did, so that it's like showing that it is a retrospective note. Urinalysis taken and positive. Medical team informed. Something like that. But it's really important to make sure your documentation is good. Documentation is used for a lot of things. If a professor wants to carry out a like clinical research, if they want to they're going to use medical notes. And if you think about it, your good like clinical record keeping will or could one day enhance clinical knowledge, So like taking that on also will help you to make sure that your documentation is really good, it's precise, it's unambiguous, it's chronological, and it shows effectiveness of care and good decision making. So I hope this video was helpful for you. If you liked this video, please give it a thumbs up, subscribe, and hit the bell notification so that you may be notified every time I do a video. Until next time, stay safe, stay blessed. Bye.